Today I am going to talk to you about the effects that drug and alcohol use during pregnancy can have on unborn babies. This is a topic that should catch the attention of every person here today, because no matter who you are, you will either become pregnant someday or know someone who is. And the fact of the matter is, there's nothing good that can come from the use of drugs and alcohol during pregnancy. Although the use of drugs and alcohol during pregnancy doesn't always harm unborn babies, the fact that they can, should be enough of a reason to not take the risk. Women who use drugs and alcohol during pregnancy are putting their unborn babies in danger and are just being plain careless and irresponsible. So starting today, I would like to encourage all of you to think about these unborn babies that could be affected, and join the fight to stop pregnant mothers from using drugs and/or alcohol. To start, I would like to explain the effects that can occur due to alcohol use during pregnancy. According to the Center for Disease Control and Prevention, prenatal exposure to alcohol can cause a range of disorders known as fetal alcohol spectrum disorders. One of the most severe disorders of drinking alcohol during pregnancy is fetal alcohol syndrome, known as FAS, states the University of South Dakota. FAS is one of the leading known preventable causes of mental retardation and birth defects. If women drink alcohol during their pregnancies, their babies are at risk of being born with FAS, which is a lifelong condition that causes physical and mental disabilities, states the Center for Disease Control and Prevention. The characteristics of these mental and physical disabilities include abnormal facial features, growth problems, and central nervous system problems. FAS babies might also have problems with learning, memory, attention span, communication, vision, hearing, and/or a combination of these. Many of these problems will lead to difficulties in school and problems getting along with others. FAS is a permanent condition, and it affects every aspect of a person's life. FAS also affects the lives of the sufferer's family. Now that you know about the effects that alcohol can have on unborn babies, I would like to explain the effects that drugs can cause. Just as alcohol use during pregnancy can lead to a range of disorders for unborn babies, drug use can do the same. Women who use drugs during their pregnancy run the risk of having babies who are born premature or have low birth weight, breathing difficulties, low blood sugar, and/or bleeding within the brain. The use of some drugs, just like alcohol, can cause developmental delays and/or behavioral and learning problems. These babies whose mothers use drugs during pregnancies are also have an increased occurrence of infant death. Babies whose mothers use drugs during their pregnancy can also be born dependent on whatever drug their mother used, states the American Pregnancy Association. Drug-addicted babies can suffer from withdrawal symptoms such as irritability, tremors, sleeplessness, diarrhea, fever, muscle spasms, joint stiffness, and difficulty feeding. Defects of the genitals, kidneys, and brain are also possible. Mothers who inject themselves with narcotics are more susceptible to HIV, and HIV can also be passed on to their unborn child. HIV is a very serious illness HIV is a very serious illness and one that will affect these babies for their entire lives. As I've already explained, the effects of drugs and alcohol use during pregnancy can be very severe, and the severe effects are ones that do not go away. The effects of drugs and alcohol use during pregnancy can last for the baby's entire lives. According to the American Council for Drug Education, some of the problems that babies develop due to alcohol and drug use during pregnancy will affect them for their entire lives. Babies who are born with FAS or whose mothers use drugs during their pregnancy will have to live with the resulting problems forever. As I previously stated, babies who are born with FAS can have problems that are both problems with physical and mental development, problems with memory, attention span, communication, vision, hearing, and/or a combination of these. Any and all of these issues can cause problems in school. However, they will also make it difficult for these individuals to function as normal adults. These babies will also have to live with the physical abnormalities as well for the rest of their lives. Babies whose mothers use drugs during their pregnancy also have many other lifelong related problems, especially if they do in fact become infected with HIV. According to the National Institute of Allergy and Infectious Diseases, babies who are born with HIV can commonly develop neurologic problems such as difficulty walking, poor school performance, seizures, and other symptoms of HIV encephalopathy, which is a brain disorder. Bacterial infections are also more common in children with HIV, and which can lead to hospitalization. Severe candidiasis, which is a yeast infection that can cause unrelenting diaper rash and infections in the mouth and throat that make eating difficulty, is found frequently in HIV-infected children as well. After enduring all of these childhood problems, HIV-infected children will have to live with a life that is dependent on medications and will always be more susceptible to sickness and infection. To avoid causing your unborn child or any unborn child to have to deal with any and all of these problems, remember that ingesting any amount of any of these substances is considered unsafe during pregnancy, and the best option is to avoid them altogether. Women who use drugs during their pregnancy are putting their children at risk of being born with unneeded health and or developmental problems. These women are also putting their children at risk of death. So from this day forward, get involved and advocate for women in your life to never use drugs or alcohol during their pregnancies. And if they won't do it for you, ask them to do it for their unborn child.